Hi, we are the Doctors Bjorkman, a physician couple that has gone week by week through pregnancy with you over this past year and actually just had a baby ourselves.
Yeah. And so each week we try to bring educational information about things in pregnancy and parenthood from our expertise as physicians, but also our real life experiences as we've been living it all ourselves for the first time.
Yes. So this week we are talking about a topic and a question we get asked all the time.
And that is C-sections.
This is a surgery that I have done hundreds of times, and so we are going to share with you kind of what to expect, as well as some tips and tricks to make recovery as best as possible.
And just in case this is your first time meeting us, I'm Kurt. I'm a board-certified pediatrician and now first-time dad.
I'm Sarah. I'm a board-certified OBGYN and first-time mom, and we are
the Doctors Bjorkman.
As we mentioned, this episode is all about cesarean deliveries or C-sections. And C-sections are actually one of the most common surgeries done in the United States every single day, with 1 out of 3 babies being born this way.
Today, our big goals are to talk about what could potentially lead you to needing an emergent C-section and what that process would look like, and then also talk about planned C-sections and how to optimize your recovery from a C-section, whether it was planned or unplanned.
Recent statistics in the United States show that about half of all first-time C-sections were unplanned, and a quarter of those first-time C-sections happened emergently for distress of the baby.
Yeah, and this was actually something that was on my mind when we went in for the birth of our baby, having spent many years and times coming to the operating room to care for sick babies that had been delivered because of an emergent C-section. I was wondering, was that a possibility for us, and what did we need to do to prepare?
This is a good time to mention that your OB or your midwife is going to do everything they can to get you that vaginal delivery if that is what you want, because we know that vaginal deliveries tend to have an easier recovery and less complications. That being said, labor can be very unpredictable and things can change very, very quickly.
And so your OB or midwife will recommend a C-section if they believe at that time that's going to be the thing that will lead to the safest outcomes for mom and or baby.
Yeah.
Some common reasons for unplanned C-sections are things like fetal distress.
So that means that your baby is showing us signs during labor that they are not tolerating this labor process.
Or if baby stops progressing through the birth canal during active labor.
Which is sometimes called failure to progress or arrest of dilation or descent.
Yeah, and they can also happen for emergencies for mom, things like a prolapsed cord, a
placental abruption,
or a uterine rupture that could cause major blood loss for mom. The reason we wanted to cover unplanned C-sections first was just so that you knew that even if you have planned to have a vaginal birth, there are emergent situations that could come up that would require needing a C-section.
So if this happens, know that your OBGYN is there to guide you and baby through the birth process as safely as possible. My first job at the end of the day is to make sure that we have a healthy mom and a healthy baby. But it's also really important that you are informed and feel like you are part of the process. An OBGYN or midwife's goal is always to have a healthy mom and healthy baby during and after delivery. And I used to think that that was all that mattered. Healthy mom, healthy baby. But I have learned that there certainly is more to it than that. Things can happen during labor that affect your birth experience and your whole life. Expectations can be turned upside down, and emergencies can happen that are pretty traumatizing, even if there is a happy ending. So if you end up having a traumatic or unexpected event during your birth process, please try to debrief with your birth team, talking about what happened and why. Birth trauma is a very real phenomenon, and the emotional scars from this can be easily overlooked in the busyness of dealing with an emergency and caring for a new baby.
The information we're going to share with you for the rest of this episode is going to pertain to all C-sections, whether planned or unplanned.
Some other indications for a C-section include if you've had a C-section before. Though if you've only had 1 or 2 C-sections, a VBAC may be an option for you. More about that in another episode.
It could be if you have multiples, or if baby is breech, meaning they're butt down which could be a potentially dangerous vaginal birth.
Yes. So another thing that can happen is mom can have abnormal placentation, or something is wrong or unusual with the placenta, like a placenta previa, a placenta accreta, or a vasa previa. Mom could also have some kind of infection that's very high risk to transmit it to the fetus, and so occasionally we recommend C-section in those instances as well.
C-section may also be recommended if there's special bleeding disorders for baby, or if baby's really big, meaning the word is macrosomia. So if mom doesn't have diabetes, the cutoffs for that are 5 kilograms, or about 11 pounds suspected for baby. Or if mom has diabetes, the suspected cutoffs are 4.5 kilos, or about 10 pounds for those babies.
So 2 other reasons that we might recommend a C-section is if the mom has had prior uterine surgery, meaning often a myomectomy, where they have cut through the whole muscle of the uterus and entered the endometrial cavity. We'd recommend it then. Or if they have something that's kind of obstructing the outlet or obstructing the door for baby to get out, like a really, really big fibroid or a pelvic fracture, are some things I can think of where we might say, hey, a C-section is the safest route.
As you know, C-sections are often scheduled ahead of time. This could be either because you've had one before and know you want to have another C-section, or if there's some indication, like the things we've talked about, for mom or baby to have one. If this is going to be scheduled, it's usually scheduled between week 39 and week 40 of pregnancy.
And we are now going to walk you through what to expect if you are going to have a planned C-section. So in the weeks before your C-section, at those doctor's appointments, it's a great idea to review the medications that you are taking in case there's something you would need to stop before your surgery. And it's also a great time to discuss and think about what you want to do for birth control after the baby's born.
Now, is that because if they're going to be doing surgery, they could do tubal ligation at that time if you knew you were done having babies?
So that is one option. If you want to have your tube side at the time of surgery, that is one reason to talk about it ahead of time. But there's also nowadays other birth control options that can happen when you're in the hospital. Sometimes an IUD can be placed during the time of your C-section. It's called a post-placental IUD. And also sometimes you can have a Nexplanon placed the day after the baby's born when you're still in the hospital. So just talk to your doctor about what those options might be.
Gotcha. And as we've mentioned in other episodes, during these visits is a great time to think about who the baby's pediatrician is going to be, planning for that. And also, we can't recommend enough to stay active and healthy as possible, as the better health you're in before major surgery makes recovery that much better. So healthy diet, exercise as you're able.
Another thing to discuss at those appointments before your C-section is how your incision, that C-section incision, is going to be closed. There's some different options. Suture, staples, and glue. And if you've had a C-section before, you may have some feelings about that. It's a great idea to just talk to your doctor about what they do so you know what to expect when that bandage comes off for the first time.
Yeah. It's also really good in preparation for any major surgery to talk with your physician about pain control. Yeah. So specifically for C-sections, there are some special options for pain control immediately after. It could be that they leave the epidural or infusion going a little bit longer to help with that pain immediately post-op. Yep. They can also use IV medications for that immediate post-op period too to help keep your pain under good control.
But you are probably going to be transitioned to by-mouth medications as soon as you are eating, and this is very adequate for patients. They're usually on Tylenol around the clock, Motrin around the clock, and then some kind of narcotic to help with that breakthrough pain. Expect, though, that there is going to be a big emphasis on controlling your pain without narcotics. So this is just something to talk with your doctor about ahead of time so you know the plan.
The day before your C-section, you'll likely have to go to the hospital for your pre-op screening and also some extra education. They will review your medications, let you know what time to arrive the next day, and then also do some blood draws to get your blood type, and probably a COVID screen now too. Really? Each hospital has their own policies, but what we're going to go through next is kind of general practices that you can expect.
The first thing I want you to remember is to restrict solid foods for 8 hours before your surgery. And this is to prevent lung and surgical complications from vomiting. So we want your stomach to be completely empty. Generally speaking, you are allowed to drink clear liquids up to 2 hours before your surgery. Your doctor may actually ask you to drink about 8 ounces of apple juice at the 2-hour mark before your surgery. But again, This varies from hospital to hospital, so make sure you understand what the policies and directions are from your doctor regarding eating and drinking before your surgery.
Yep, and the reason for that is that if you end up eating past that 8-hour mark, it could delay your surgery and delay you getting to meet your baby for the first time.
Yes.
But just to review, things that are clear liquid, so these are things that you could drink within that 8-hour mark, but stopping at 2 hours would be things like water, black coffee, clear Gatorade, clear tea,
clear juices,
apple juice, white grape, things like that.
Yeah.
It is important if you're going to drink coffee, don't add anything to it, so no milk, no creamer, and no adding like lemons to any of the other drinks.
Right. And do not swallow any mints, any gum, anything like that. Your stomach needs to be completely empty. The next thing you should know is not to shave your stomach or pubic area before your C-section.
Like how long before?
Usually about a week of not shaving your stomach, your upper thighs, or your pubic area. It can actually cause little nicks in the skin that can promote infection after your surgery. So if you have hair down there that needs to be trimmed before your surgery, your nurse is going to take care of it preoperatively. You don't need to worry about it. It doesn't bother us a bit.
Yep. It's also good to make sure you remove all of your jewelry before this happens too.
Yeah. The next thing to know is that you will probably be asked to either shower or use this special wipe to clean your skin the night before or the morning of your surgery. It's called CHG. And so your doctor or that nurse is going to give you instructions on how to use this special wipe or this special soap to make sure your skin is really clean before your surgery to help decrease the risk of infection. So let's talk about what to expect at the hospital. You have gotten to the hospital. It is the day you're going to have your baby. The first thing that's going to happen, usually, is they are going to hook you up to some fetal monitors, monitor the baby, make sure everything looks good, and often do a quick ultrasound to confirm the baby's position, head up or down.
Yep. And while they're doing that, there's probably going to be a nurse who's going to place an IV that's going to allow them to give you fluids and IV medications during the procedure.
Yep. And after that, your nurse is also going to look and see if they need to clip any hair. Remember, don't shave.
Yep. And then you get a chance to talk to anesthesia, talk through their part of the procedure, and if there's any consent forms you haven't signed, these will also be completed at that time.
Yep. And you'll normally also see the doctor that is going to deliver you, or if you're meeting them for the first time, they usually come see you preoperatively. After that, it is time to head to the operating room. Know that occasionally emergencies can be happening, so your procedure may get bumped, but we try very hard. Usually scheduled C-sections are in the morning. We try to keep those running on time.
Yep. Then once you get in the OR, it's time for the anesthesiologist to do their job and get your anesthesia going.
Yep.
Of note for planned C-sections, the goal is to have you awake for them, so they use things called spinal or epidural anesthesia that has you numb from about your breasts down to your toes.
Yes. So once you're starting to feel numb and tingly, they're going to lay you back on the bed and they're going to do the rest of the things to get you ready for the surgery. And one of those things is to put SCDs, or little squeezers, massagers on your legs that help prevent blood clots. You know, those go through the whole surgery and often postpartum.
Yep. They'll also place a Foley catheter, which is a thin tube that just helps to drain your bladder throughout the procedure.
Yep. The next thing they're going to do is wash your abdomen with a special soap to make sure, again, we're doing everything we can to minimize the risk of infection.
Yep. Then after that, this is usually the time they go and get your partner to come in, who's likely been waiting out in the waiting room. They will likely ask your partner to put on special OR appropriate attire just to help keep things sterile and clean in the operating room.
Yeah, but they usually get to sit right up by your head, right up with anesthesia. They can hold your hand during the procedure. After that, your OBGYN is going to wash their hands really well and come in and get also dressed in special sterile clothes to do your surgery. And then they test your anesthesia. Always, your OBGYN is going to test your numbness to make sure you are numb enough and comfortable to have this surgery, because you are not supposed to feel pain, just sometimes some pressure and some tugging.
Yeah, but please feel empowered to speak up if you don't feel appropriately numb.
Yep.
But at this time, now it's baby time. So this is a great time to make sure that the music you want playing is playing in the OR.
Yes.
You can also make sure that the team is aware of any kind of requests and desires you have for a gentle C-section, which can be making sure that you've got a clear drape so that if they allow it and if that's available to them, that you can see when baby comes out.
Yeah. So you're going to be in the operating room for usually 60 to 90 minutes. The baby is usually delivered in about the first 10 minutes, and then peds takes the baby, quickly checks to make sure that everything is okay, and then brings them right back to you and your partner at the head of the bed. And often, they can do things to help you do a little skin to skin right there in the operating room, or if not, your partner can do some skin to skin and you can see that sweet baby while your OBGYN is finishing your surgery and putting everything back together.
Yep. It's important to note that, of course, if there are any issues with the baby may not be able to do some of these skin-to-skin things and may need higher levels of care that would require them to go to the neonatal intensive care unit.
Yeah.
Oftentimes, your partner's going to be able to go with them
Yep.
or shortly thereafter to check on baby.
Yeah. It is really important to know that we do encourage skin-to-skin bonding in the recovery room and even in the operating room when possible, because it has been shown that this helps with your baby's breathing, temperature, heart rate, and all these really important benefits right away, and it can help establish breastfeeding. So keep that in the back of your mind as things that we are also trying to do while we're finishing up your surgery and getting you recovered.
Yeah. And then, as you can imagine, in instances of emergent or urgent C-sections, a lot of these things that we've just gone through are going to be very different. And so I think a big difference is going to be that rather than being awake and having an epidural anesthesia, often you may need to be under general anesthesia or completely asleep.
Meaning mom's asleep.
Yeah.
And so that can be really hard. Yeah.
Yeah. So, are there any other important differences between the planned C-section and the emergent ones?
The big thing is if it's a real emergency and they can't get your anesthesia dosed up quick enough where you're numb, then they will recommend that you be put to sleep, because that can just happen really fast. Mm-hmm. Sometimes if you have had an emergency C-section, your pain afterward is a little more intense. Because you were under general anesthesia and you don't have that epidural that kind of lingers for a few hours after surgery. And sometimes when you have an emergency C-section, the doctors do a different kind of incision. They do an up and down incision called a vertical midline incision, as opposed to, the fan and steel or, kind of circle bikini incision that you think of when you think of a C-section. And those big midline vertical incisions are great because it allows us to see things a lot better and do things really quickly. But again, in terms of pain and post-op recovery, it can be a lot more intense. So those things that happen in emergency may also make your recovery a little more difficult and have to work on some pain management type things.
So after this surgery is done, they're going to bring you back to the labor and delivery room for your rest and recovery period to happen. You'll also, this is times where the nurses are coming in, checking your vitals, checking in on baby. You'll also start to feel a sensation coming back in your legs as that anesthesia wears off.
A lot of patients are surprised that we expect them to be up, moving around, eating, using the bathroom on their own within a few hours of having surgery. And barring infection, digestive issues, things like that, once you can walk around, you can eat, and you're not throwing up, and you can pee, you're usually ready to go home, and that's generally within 48 to 72 hours of having a C-section.
Yeah. And as Sarah mentioned, one of the best things you can do is walking to help encourage your healing process and also to prevent some other post-operative complications.
Yep.
You may also notice your appetite's a little bit lower after surgery. You may need to eat some smaller meals at first. And then also, of course, another important part of this post-operative time is just transitioning to being a new mom, or at least a mom of a new baby. So these are things like working on breastfeeding with lactation, and then also all the other newborn cares.
Let's talk about pain control immediately after surgery. So often the pain control, pain medicine that you're given during surgery and that epidural kind of lingers. On top of that, you are probably going to be getting acetaminophen and some kind of
Which is Tylenol?
Tylenol and some kind of Motrin around the clock as like your base pain control. Sometimes you'll get an IV medication, IV NSAID called Toradol that they give you through your IV for the first 24 hours, but that's kind of your base. If you have more pain than that is tolerating, they'll give you usually some kind of opioid, and these are things like hydrocodone or that's Vicodin or Norco or things like that, to kind of bring your pain level down. They're going to try to focus on pain meds that are not narcotics because we know those cause all sorts of problems.
Yeah. And along that, one of the biggest complications of opiates is constipation,
Yep.
which is something that is an issue post-operatively either way. So another big part of your medication regimen after a C-section is going to be things to help
Bowel
with constipation
regimen.
and a
Oh,
bowel
yeah.
regimen.
Yep.
Other things that you could expect are anti-nausea medications if you're having any nausea afterwards.
Yep.
Sometimes moms may require something called Rogam if blood types didn't match up between them and baby.
Yep. So again, most women are going to go home 2 to 3 days after their C-section. We want to make sure before you go home, though, that you can walk around, that you can pee like usual, that you are eating normally and not feeling nauseous all the time, and that your pain is controlled with medications by mouth. So those are the big things you have to be doing before we can send you home from the hospital. All right, what happens when you go home? So the first thing on your mind is pain control. I want you to take your pain medications as prescribed by your OBGYN. General recommendations for pain control after a C-section are going to be acetaminophen, so that's Tylenol, 500 milligrams every 6 hours, and Motrin, 600 milligrams every 6 hours. That's your base. I recommend that patients set an alarm for 6 hours so that they remember to take these medications. You are so busy with a new baby and trying to sleep that there's nothing worse than getting behind on your pain medication because you forgot to take it. So you're taking that Tylenol and Motrin as your base pain control. Your OBGYN is also probably going to have sent you with some kind of opioid or narcotic like oxycodone or Vicodin or Norco or something. If you find that Tylenol and Motrin isn't cutting it, like you can't walk around, it hurts for you to reach for the refrigerator, you aren't comfortable holding your baby, you probably need to take something a little bit stronger, and we want you to be able to do those things with your baby.
Yeah, I think with the opiates, it's important to know like you want to have not so much that you're so sleepy that it's dangerous to care for your baby, and not to drive while taking opiates.
Very important. But I do find that first day home, patients are in a lot more pain than they were at the hospital, and it's not because anything is wrong, it's just because you're at home, you're doing a lot more. You get up to go to the refrigerator, you walk farther to the bathroom, nobody's bringing you the baby as much, and so you probably will be more uncomfortable that first day home. Stay on top of your pain meds.
Yeah. Other things that are really important once you get home are to try to walk, get up, ambulate as much as you're able to and can tolerate.
Yep.
It's good to remember to eat healthy foods. You can definitely take a shower. Don't submerge your C-section, but you can shower. You can let water run over that incision site. You'll notice there's likely some white tape called Steri-strips over it. Try to not pick those off unless they've been there for over a week. They will usually fall off in around that first week of time.
Yeah. So as far as activity restrictions go, for 6 weeks after your C-section, you need to kind of limit your household chores. Don't lift anything heavier than 10 pounds, and keep in mind that a gallon of milk weighs about 9 pounds. So that's kind of how much it's okay to lift. You want to make sure you are giving your abdomen time to heal. Other things to think about is no douching, no sex, no tampons, nothing in the vagina. Sitz baths are okay. And it is absolutely okay to go for walks, walk up steps, stay active, but if it hurts, don't do it.
And then once you're home, what are reasons that your OBGYN is going to want you to give them a call?
If you have a fever, more than 100.4 degrees, if you are starting to notice a lot of redness around your incision, if it is starting to drain, not clear fluid, if it's draining something that smells bad or is kind of thick, if you feel like you have a headache, vision changes, pain right here in your right upper quadrant, if you feel dizzy, or if you have any really heavy bleeding. Generally your vaginal bleeding decreases as the days go on, but if all of a sudden you are just having large blood clots or an increase in bleeding, you're going to want to call your OB.
Gotcha. And so I think that's going to be it for our episode this week.
Yeah.
I think our big goals are that whether you have a planned or unplanned C-section was to give you guys some insight into what that process looks like and how you can be informed and also interact with your OBGYN during that time.
Yeah. If you have any questions, please leave them in the comments below. We want you to have the best experience possible, even if you end up with a C-section you didn't expect. We will see you guys next week.
Yeah, bye guys.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.